Hi, good morning to all. I am Prof.Manavalam. Now we are going to see about the current issues faced by the nurses during the nursing practice part 2. It is a continuation of the part 1. First one is stress. Already we seen how the nurses are exposing to the stress. First one is because of high workload, long working hour, frequency changing. Because of that, they are having the long working hour. It leads to physical stress to them. Next, emotional demands. Nurses always they are handling the cases those who are having only sufferings, most of the time sufferings, and also they are facing the many deaths in their day-to-day practices. It is automatically bringing them to some of the emotional stress, lack of support. They are sometimes the nurses they are not getting adequate amount of support from the higher officials, from the management, in the sense of allocation of resources. If they are not getting adequate number of resources to render the patient care, means automatically it leads to dissatisfaction, end up with the stress to the workplace violence. It is not only exhibited by the management or the colleagues, it is also exhibited by the patient and the patient relatives. They are verbally or non-verbally they are abusing the nurses in a different scenarios that end up with the stress to the nurses. Next one is making decision. They are having the dilemma. So dilemma may be in ethical dilemma means whenever the patient they are in the terminally ill condition, there no chance for the survival of the patient by continuing that particular treatment that time. So you as a nurse along with the doctors, you have to take a decision whether continuation of treatment is good for the patient and families, or it is because of continuation of treatment whether the family is suffering by financially and as well as physically, emotionally. That decision you have to take in a proper way. Always it is a confusion one. So you may think whether whatever decision we are taking, whether it is a right decision to everyone or it is wrong decision. That dilemma is every time the nurses are facing in their practice. So mainly where they are facing this dilemma means end of life care. The patient, those who are in the terminally ill patient, so we have to withhold the treatment for that patient. That time they may have. Next, informed consent. So before doing any type of treatment or procedure, we have to give information to the patient. So the patient they must well inform about what they are undergoing. So during that time, sometimes certain information if we are giving to the patient, the patient may get the fear and anxiety for exposing that particular treatment. That time we may have the confusion. Next, allocation of resources. We may have the difficulty to whom we can allocate the we use the available resources to provide care. Sometimes there may be a difficult to prioritize the needs of the patient, allocating the available resources to provide the care. Maybe sometimes we may encounter that kind of situation. That time we may have the difficulty in making the decision and allocating the resources to provide the to meet the basic needs of the patient. So this is one of the major problem encountered by the nurses. Next, diversity of nursing care. Definitely nowadays because of global migration, every country they are combined of every cultural person and a different country personnel in them. So at the same time the nursing also they are into the diversity. So in the diversity it may be in the workforce. So diversity means they are handling different culturally sensitized personnel. So the nurses, those who are working in the what they must sensitize their cultural practices, their religious practices, their customs, everything they have to take into account while providing care. So it is sometimes they are not having that much knowledge about the different type of person's culture. That time they may have the difficulty to deliver the services. Next one is addressing the bias. So they have to recognize and mitigating the unconscious bias. Sometimes unconsciously, without knowing, they make a unconscious bias. Take as example, without knowing the race, age, age, they may differentiate the persons and take a decision and providing the services to them. Next, cultural competent. Nurses, they must culturally competent enough in order to render services from the different country people or different cultural people. So they must ready to learn the different cultures where they are working. So Indian nurses, they are not only working in Indian, or they are not only handling the Indian patients. We are getting, it is become a hospital. India become as a hospital hub. So we are receiving different cultural people from the different countries. So we must ensure ourselves or update ourselves to culturally competent nurse. Equitable healthcare. Without showing any partiality, we have to provide the fair and justice of patient care. So this bring out the good results. Next, technology navigation. So by introducing the technology into nursing services, it is not only easing the nursing personal workload. At the same time, it is also giving certain stress as well as issues to the nurses. So what are the issues the nurses facing while introducing technology into the practice? First one is training and support. Most of the nurses, they are not having adequate training to using the newer technology. So they must need the extra training to use that technology into the practice in an effective manner. Next one is electronic health records. Nowadays everywhere they are using the electronic health record. It enhance efficiency, but at the same time they must sit in front of the computers and do the long hours of work to feeding the data into the computers. That knowledge they must have. At the same time, the data security also, it is a emerging issues in that. So privacy of the patient details is not secured in case of we are using the technology. That privacy and security we have to ensure as nurses, those who are feeding the data, they have this is extra workload for us to secure the data and maintaining the privacy of patient data. So this is also extra workload for us nurse. Next, telehealth. Telehealth is a easy one. We are using the technology for integrating the patient. But at the same time, they have to adopt the new communication method. For this, they have to need intense training. So for this, they have to apart from their working hours, they have to spend a lot of time period to learn the newer technology, and they have to learn how to apply into the day-to-day practices. It is not reducing the time, it is increasing the time workload and time spending in the hospital sectors. So these are all the certain problems or issues encountered by the nurses. It is not solved by the single effort. It may be solved by ongoing education, policy making. The group of policy makers, they sit together and they have to prepare the policy in order to reduce this stress issues and improve the efficiency of nursing workload. This done by the commitment to innovation. So every nurses, they must themselves committed to accept the innovation and creativity. They very readily they have to accept and go with that, because it is dynamic one. We ready to accept that and we have to go on the flow, then only we can survive in this society. So I hope everyone understood very well about the issues commonly faced by the nurses in the nursing sectors. Thank you all.